Bwaise is one of the sprawling slums in Kampala city with narrow pathways, congestion of humans, motor vehicles and dilapidated houses, unsafe water and poor sanitation. Not surprisingly, the health of the residents is highly compromised. Highly infectious diseases like tuberculosis can easily spread in such an environment, yet seeking and access to health care is limited by many factors. For 2 years, the National TB and Leprosy Program of the Ministry of Health in partnership with the International Union Against Tuberculosis and Lung Disease, the Union, and WHO's Stop TB Partnership have worked out a health package for such a populace in a project called Slum Partnership to actively respond to tuberculosis in Kampala district, Spark TB.
We found out that actually there's a community within Kampala not receiving TB services, and that's really the slum community. And the reason was because 60% of them seek services in the private for-profit clinics, and yet the health workers in these clinics did not have the knowledge and skills to diagnose TB.
Country Director for the Union, Dr. Anna Mukwaya, says many such people don't test for TB and end up dying from a disease that is curable. The Union supported the ministry to establish a public-private partnership while small clinics in slums would be aided to diagnose TB.
Put them on the treatment, record them in the national registers.
One such clinic is Pillars Medical Center in the middle of Bwaise.
On average a month, we have 6, and out of the 6 you can find like 2 positives.
Their tests are also quality assured by the National Tuberculosis Reference Laboratory. You find that a clinic like this one in the last 1 year, they have diagnosed 45 additional TB patients. These would have been missed.
Head of the TB and Leprosy Program in the ministry, Dr. Frank Mugabe, says through this approach, about 1,000 people have been diagnosed and treated in Kampala alone in the 2 years the project has run. The private clinics get the drugs at no cost, just like government facilities, but supervision is continuous.
But we are lacking a safety cabinet as us, the lab personnel.
We're now working with the government to see that they facilitate them to get equipment like the microscopes.
Ministry of Health figures show that there are about 1,400 health facilities in Kampala, and of these, about 93% are privately owned. According to the Uganda Bureau of Statistics, 5 of every 10 people who catch any disease first seek care from the private clinics, which are accessible and less congested. For instance, the average distance to private health facilities in Kampala is 1.5 kilometers, compared to 6.4 kilometers to a government hospital or health center.
If the private providers in the urban cities are seeing the majority of the cases, you cannot ignore them.
In the first year, Spark TB took on 70 private clinics in Kampala, but now there are about 150. The project has been expanded to other districts like Jinja, Mukono, Bwaise and Wakiso. Residents have also been engaged. John Kisembo is a community health worker covering Bwaise 2 and Bwaise 3. Since the TB project started, village health workers have been vital in bringing the patients or suspects to the clinics. John has been able to mobilize over 250 suspects, and of these, 60 were discovered to be positive for TB. One of them is 6-year-old Hiziri Bukenya.
I was moving around with my megaphone, mobilizing people to go for HIV testing and TB testing. That's how I got this patient.
And the mother, Sarana Juka, who saw her son get different diagnoses without clarity, is glad John was in the area that day. Hiziri and his mother are now relieved. The mother often ran to get him from school whenever he had bad episodes. The family lives not far from the private clinic where Hiziri got his treatment. He's amongst 57 of John's positive patients whose TB has cleared.
Good.
But 3 of John's patients did not live.
TB was at a severe stage.
But John soldiers on, referring suspects to Pillars Clinic, which charges a fair consultation fee of 5,000 shillings, about $2.
Because this is a private clinic, so we still have to maintain the business model if we're going to motivate them to continue collaborating with the government.
It may be curable, but TB can kill if reported late. According to WHO, TB is the world's leading killer after HIV and AIDS. In 2013, 9 million people were infected and 1.5 million died worldwide. Since Spark TB has shown results, the Ministry of Health intends to roll it out to other urban centers in the country.
And that's the funding they're requesting through the Global Fund and other partners in country.
We still miss some 16,000 TB cases every year in Uganda. Our treatment success is now at 80%. We should be at 90% globally, and we have multi-drug resistant TB.
Over 400 people are on treatment for MDR TB and more are being diagnosed. This is still a grim picture, which is not helped by the high co-infection rates of TB and HIV. Diagnosis in children is also tricky.
It is very sad to lose a person at a curable disease.
Uganda is among 7 of the 22 TB high-burden countries globally that have achieved Millennium Development Goal 6 of reversing TB infections. Florence Naluyimba, NTV.